Well, I just can't say it enough. Ladies, get your mammogram. It's a very important message. So where do you go? I'm so excited today. I'm at Solis Mammography. I'm with Dr. Erin Bravo. She is a breast specialized radiologist here. Thank you so much for having us here.
Oh, thank you so much for coming out. We're so happy to have you here.
Well, because this message is so important, isn't it? I mean, you're preaching to the choir every day.
Absolutely. Seriously, mammography, getting that annual mammogram is so important.
So let's talk about a mammogram, because I think there might be some women out here who just don't know what it is, what to expect, what do you learn? What is it?
You're exactly right. We hear the word all the time, mammography, mammogram. So what is it exactly? So this is a mammography unit. This is the unit that captures the picture. It is an X-ray, so there is a tiny, tiny, tiny amount of radiation in order to obtain the picture. And what this does is it allows us to analyze the breast tissue. What is going on? Are there any abnormalities that are happening in the breast tissue at that time?
So we know that it's very important for women to get these regularly, right? So let's talk about, because technology is also advancing all the time. So we talk about a baseline, right? That's that first mammo, and that needs to be done at age 40, right?
Correct.
Okay.
Yes.
What do you learn from that baseline?
So the baseline mammogram is so important. A baseline mammogram is the first mammogram that a patient will get. Current guidelines are that women at average risk have a baseline mammogram at the age of 40. This is so important, like I said, because this allows us, are there any abnormalities in your breast tissue at that time? Okay. Then we're able to deal with any concerns that we might have at that time. However, if the baseline mammogram is normal, that's fantastic. But this mammogram will still serve a very, very big role going forward, because in the future mammograms that you receive, we will constantly be looking for any subtle changes that could be happening on the subsequent mammogram.
That baseline follows you through your life.
Absolutely.
I mean, that's the Bible, right, of your breast tissue.
You are exactly right. That is the Bible of your breast tissue.
A lot of people think, and you know, I took everybody on my journey getting my mammogram, so it's not scary. It doesn't hurt. You know, you say most women will keep their Botox appointment before they keep their mammo appointment, right?
Yeah, absolutely. Like we were joking about. I said, hey, you know, I never want to miss my Botox appointment, but getting that annual mammogram, you just, you know, it's not as enjoyable. It's not as much fun, but it is a very quick appointment, minimal pain, minimal discomfort.
Yeah.
It's, you know, a very quick exam. Yeah. You did it. You can rest assured that you're doing everything that you can for yourself to find a breast cancer as early as possible.
That's it. That's really the message. What makes you guys unique here at Solis Mammography?
So Solis Mammography, breast radiology is our area of expertise. And so we do have the latest and greatest technology, which allows us to really do the best that we can when reading a mammogram. We use AI technology, reading our 3D mammograms, and this helps us to find cancers that are even smaller and smaller than we would without this technology.
Wow.
So we're finding cancers very, very early and at a very small size.
Which is the whole point of getting your mammogram, so that you can, if there's a problem, and we hope there's not, that you can detect it very, very early.
Absolutely. The other thing, you know, this is what we do. We see breast cancer patients, we see women that are coming in with concerns about developing, that they could have a breast cancer. So we want to do everything that we can to make them feel comfortable. And we are good at that here because we have so much experience in that. And we understand this is stressful for women.
Because that's what they do. Well, Dr. Bravo, thank you so much. Don't go anywhere, because we're not done with Dr. Bravo yet. We are going to continue to talk to her, because believe it or not, more and more women are getting diagnosed with breast cancer at a very young age. We're going to talk about that next, and what to watch out for on social media. Thank you, Dr. Bravo.
Thank you.
Solis Mammography has 4 locations: Phoenix, Paradise Valley, Chandler, and Glendale. Call 833-510-9396 or visit solismammo.com.